Video number 4 for our series of test-taking strategy on pharmacology, how to approach pharmacology questions. Straightforward, you don't have to struggle. This one, the same thing, high yield topics that you have to know. I pick questions to make you think, right? Straightforward, right? You know this, but what do you think? Figure it out and you'll be fine. And then reading from the back, and then you recommend which medication. So which medication will you give? And then she's caring for a client with what? Severe acute dystonia. 2 words. That's all you need to focus on. Dystonia and what medication? Dystonia and what medication? Then you tell yourself, what is acute dystonia? I never give you a bunch of information. The board will do the same thing. Dystonia, you know this has to be related to extrapyramidal side effect. What is dystonia? It's usually severe muscle contraction. Therefore, this is related to muscle contraction. If it's a EPS, how do you break EPS? Treatment for EPS, there's a couple of portions of EPS. Akinesia, acute dystonia, right? Parkinsonism, and tardive dyskinesia. Akinesia is the only one mostly we like to use benzos, or those are the very good medication we use, or beta blocker to slow you down. But most of this anticholinergic is good. That's all. You can also use anticholinergic for akinesia, but benzos and beta blockers are good. Okay, so I know this is acute dystonia. I'm going to look the answer choice and see if I see anticholinergic there. Narcan is used for morphine. Cholinergic, it cannot be anticholinergic. This is a cholinergic, so I'm looking for anticholinergic. This is a first generation antipsychotic. That is what is going to cause EPS. Therefore, I cannot pick it. Patient already has dystonia. Do you want to give them antipsychotic? No. Test-taking strategy, you don't know what diphenhydramine is, but it has anticholinergic effect. You see, I do not want you to struggle. Go with the content. Dystonia, EPS, it's a muscle contraction. I need some anticholinergic. I look at the answer choice and I said, Narcan is not. This is a cholinergic. Now, patient will have dystonia because they have what? They are on antipsychotic. So you shouldn't pick another antipsychotic. Test-taking strategy, diphenhydramine is your choice. Like I said, I'm trying to let you guys master this Thanksgiving Day how to answer a question pharmacology. And I hope you benefit from them. It's the same test-taking strategy you learn. You can answer it to answer any question. This is the same thing. Same strategy. You don't have to struggle. And then should teach the clients to avoid which food item to avoid. And then she's providing this chart to a client prescribed what? Ciprofloxacin for UTI. I've underlined my buzzword. I read it from the back. I read the case study. And now all I'm care about is ciprofloxacin, food choice to avoid. I asked myself, what is ciprofloxacin? It's what we call fluoroquinolone. What is the key thing about fluoroquinolone? Calcium. Calcium like to bind to them. And when it binds to them, they become ineffective. You shouldn't take any calcium. You shouldn't take anything that has calcium in it. That is my content. I don't even look at the answer choice. I come up with my content. I take my bag of content. This is my bag of content. And I take you to this answer choice. Are you a calcium binder? Tuna does not have calcium. Chicken, no. Cheese, hey, it's a dairy product. Dairy product, a bunch of calcium. Hamburger is not. Number 3, you should not take it. Right, guys? See how it's done? I hope you learned something. So don't avoid calcium and cheese. Number 3, same thing, right? Same strategy. The nurse should intervene, but I got to intervene due to the risks of what? A nurse is caring for a client admitted for what? CHF. The client is on what? Digoxin, fluoxetine, acetaminophen. The provider prescribed what? Linezolid for wound infection during the hospital stay. The client should intervene, the nurse should intervene due to the risk of what? This is a bunch of information. Sit back and make it easy, adapt NCLEX way. The AX means intervene. Case, you have CHF, you're on a bunch of medication, digoxin, fluoxetine, acetaminophen, and now I'm adding linezolid. What is being asked? Intervene, and those are my buzzwords. So if you have CHF and you're on these medications, digoxin, fluoxetine, acetaminophen, and now I had another medication, linezolid, for wound infection, what are you at risk of? The way to answer this question, test-taking strategy, look at each of these medications if there's interaction with linezolid. Digoxin will take care of the heart failure. Fluoxetine is an SSRI. You get a clue? Acetaminophen is just acetaminophen. Do you know what linezolid? I give you a clue. It was used for infection. It's an antibiotic, but it has MAOI. So MAOI features. It has a low potency effect like an MOI. So when you see that, think of it as a monoamine oxidase inhibitor. It's a form of monoamine. And what are monoamine? Serotonin, dopamine, norepinephrine, epinephrine. They are all the same. These are all monoamine inhibitors. And therefore, you should avoid them. It also has big effect as serotonin. Therefore, if I'm taking linezolid and I have SSRI, I have two things, SSRI plus linezolid, because it acts as serotonin agonist and it has monoamine effect also. We have two serotonin going on. So I'm going to get serotonin syndrome. That is the most serious effect. Renal failure is not a factor. It's not going to cause exacerbation of CHF. Of course, SSRI, you're going to gain weight, but that's not the problem. You see this? Fever, cognitive dysfunction, test-taking strategy. What does that tell you? Fever, cognitive dysfunction, those are symptoms of serotonin syndrome. I do not want to put serotonin syndrome, then you pick it. I give you fever, cognitive dysfunction. But if you can't figure out, rule out the first one. There's no evidence of renal failure, right? Even though linezolid acts like vancomycin, it does not have effect like vancomycin. So patient already in CHF, there's nothing in the question that telling you that I'm giving them too much fluid, right? Severe weight gain, yeah, if you're on SSRI, probably you're already gaining weight. But if I had linezolid, it's not going to cause weight gain. Interaction between fluoxetine and linezolid is serotonin syndrome. How do you know? I get a fever and cognitive dysfunction. That's your answer. Number 4. Number 4, last question. Sorry for the cough. So number 4, what do you guys think? A nurse is caring for a client on linezolid. Which diet choice the nurse should question? The same theme I'm trying to give you. I told you linezolid is a MOI, right? They act like that. They act also as a serotonin agonist. Therefore, if you're taking MOI, you should avoid what? You know it, fermented food, right? I did not use the word fermented, but there is fermented there. Do you see it? These are the things you should master when you're taking your test. These are the things you should do, right? Air-dried meat is a form of fermentation. When you air-dry something, you're causing fermentation. Soy sauce, you should avoid it. Red wine, you should avoid it. Aged cheese and all those things. Rice and milk does not include it. So 1, 2, and 3 are the things you should avoid when you're on the nursery because of the MOI effect. Number 4 is done. You see the questions? Pharmacology should be easy for you now. Use that strategy and you see you can kick the pharmacology no matter what the problem is. Take care of yourself and have a good day. Bye.